I'm gonna knock on the door. I'm gonna provide privacy. Hi, I'm Bailey. I'm going to be the nurse that's going to be changing your dressing today. The first thing I'm going to do is verify the order that the dressing needs to be changed. Can I go ahead and get your name and date of birth? Okay, and I'm going to go ahead and check the bracelet. Do you have any allergies? He has no allergies. Are you in any pain? He's not in any pain. If he was in pain, I'd go ahead and check the MAR, and then I'd administer his pain medication as needed, and then I'd come back in 30 minutes and proceed with the wound care. I'm gonna go ahead and provide, do hand hygiene. I'm gonna put on my gloves, and I'm gonna go ahead and assess my wound. Okay, I'm gonna carefully take this off, and then I'm gonna see who changed it and when it was changed last. I'm gonna carefully take this off. And from this point on, I'm gonna go ahead and be assessing the wound. Okay, what I wanna look for is any discoloration, if there's any drainage, if there's any odor, if there's any drains, and if there's any kind of sutures or staples, I'd want to go ahead and count those. And it looks like there is 8 sutures. So I'm going to go ahead and proceed with my wound care. Okay, I'm going to perform hand hygiene. I'm going to go ahead and take this off because the corners is not sterile. Perform hand hygiene. Okay, I'm now sterile. Okay, so I'm gonna go ahead and put my sterile field. Okay, these edges are not sterile anymore, so I want to place everything right in the middle. Okay, I'm gonna go ahead and go to my patient. I'm gonna go ahead and clean the wound. I'm gonna go down, dispose, down, dispose. Let me switch my hand. Then I'm gonna go down and dispose. Okay. I'll go ahead and get my gauze. Okay, so now the sterile field is completely finished. I don't no longer need to be sterile. I have tape, and normally some people would want to take their sterile gloves off if they're not if they're dirty and go ahead and put the tape on. But where my gloves aren't dirty, I'm just going to go ahead and proceed with my gloves on. Okay, go ahead and clean up. Okay, I'm going to take my gloves off. I'm going to perform hand hygiene, and I'm going to grab my pen, and I'm going to go ahead and I'm going to date where there's two pieces of tape overlapping. I'm going to do the date, the time, and my initials. And then what I'm going to do is I'm going to go ahead and document any abnormal findings and document that the wound care was changed.